Hi, everyone, and welcome back to Health First. Today I'm here with Dr. Kher Yee, who is a general dentist. Hi, how are you?
Hi, Emily. I'm a dentist from Malaysia. How are you doing?
I'm great. Thank you for joining me here today.
Thanks for inviting me as well.
I'd like to start off by asking, what influenced you to pursue a career in dentistry?
I think it's about braces because I have worn my braces like for 2 times in my life. So to be honest, like at first I was actually forced to wear it by my parents when I was 13 years old. So after my braces removal, right, I really feel like my life has changed. Like my friend circle, my self-confidence has actually been boosted a lot. And people start to compliment about my smile and then followed by my personality. So since then, I become more socialized and instead of worrying people judging about me, about my smile. So I think that is what bring me closer to dentistry. And also, I hope that I can actually provide people a healthy and also beautiful smile one day and make some impact on their life, like what my dentist did to me.
Yeah, definitely. I have a very similar experience actually. And
I
you're a,
really,
and you're a general dentist. Can you tell me a little more about your profession and what you do?
yeah, so as a general dentist, we actually perform um, all the dental procedure like dental cleaning, which is scaling, filling, dental crown bridge, dental veneer, denture, root canal therapy, and also wisdom tooth removal. So for me, like besides enjoy being a clinician, I actually also a content creator. So currently I will provide like creating videos or sharing clinical case and interact with my audience online on different social media like Facebook, YouTube, and also Instagrams. Like sometimes I will also do some Q&A challenge to answer their dental query. So in addition to that, I'm also pursuing a part-time postgraduate diploma currently, like to further deepen my knowledge and skill.
That's great. And I watch your videos on Instagram and they're amazing.
Thank you.
And what do you
Hope
like?
it is, yeah,
Hmm?
hope it is informative.
Yeah, definitely. And what do you like most about your profession?
My professions, basically like creating smile for my patients and also at the same time helping people to solve their problem because like sometimes when people just come for routine checkup but they don't know how bad is their dental problem, so while doing treatment I will also provide some educations to raise their awareness about how to take care of about their oral cavity. So meanwhile educating, we also making a little bit difference for people every single day life. So dentistry is also about human, art, and science. So I really love to work with all these three elements. So while doing dentistry, I meet new people and make new friends every day. So this is very exciting. So at the same time, I'm also able to provide dental treatment and plan with evidence-based, like because currently I'm pursuing a postgraduate diploma that taught a lot about evidence-based even since my undergraduate time. So with the science supporting behind, um, I'm confident with the dental treatment that I provided to my patients and also like do no harm to them. So like now I have more interest in prosthodontics, like replacing missing teeth with the prosthesis and help people to regain their smile and also regain their confidence.
Yeah, definitely. That's great. And as you know, the COVID-19 pandemic has greatly affected the world and continues to do so. So how is it like working throughout the pandemic?
I think because when I was just stepping into working field, it's like last year March. So until now, it's like stepping into a 1 year and 7 months of working experience. So when I first started, it was just the timing when COVID-19 kicks in. So, when we first started and we are so enthusiastic and excited to know like, yeah, finally I can do what I love and provide dental treatment for my patients. But who knows, COVID kicks in, so everything slowed down and plan change. And even our patient flows have been reducing a lot. So it's kind of affect my plan. But however, when things slow down, we can actually focus more on quality, because like in government sector, there are a lot of people and public flux in every day to to ask us to solve their dental problem. But now when patient flow slow down, we can actually focus on talking with my patients and focus on the consultation and understanding their concern, and take my own sweet time to practice slow dentistry and provide more better quality care. And besides that, I think before the pandemic, dentists has already practicing like infection control, like especially particularly during COVID-19 pandemic. So during the crisis, like actually we public sector, I think all the sector in country, like we are actually lacking of PPE, which is personal protective equipment. So it's kind of affect our treatment provider. So at the early stage of COVID pandemic, we only provide emergency treatments. So like patients who is having toothache or a fever or swelling, only we will see the patients. Other than that, like patient who is having, if we want to come for routine cleaning, then we are kind of need to postpone their treatments. But there was last for about 3 months time. By then, we have found a problem, because like people who is having tooth decay but they don't have any pain, but we don't provide treatment for them, then it will like actually worsen their dental problems, because we don't know how fast and how much deep the decay will go into the teeth, and then causing toothache later on. So if toothache happen, then a more complicated and complex treatment will be required in the future. So during the pandemic, there's quite a lot of things happening. Then we need to actually figure out the solution, and also try to provide the treatment as much as we can within the safety range and also adequate PPE. Yeah.
Mhm. Yeah, it was definitely a very difficult time period. And it was great that at least there was some positive that came out from it, because there was a lot of
Yeah.
negative also.
True.
And to end off, can you give a few words of advice to people hoping to pursue a career in dentistry?
I would say think twice. No, because dentistry is actually a never-ending learning journey. So while science is improving, we have to always keep our knowledge up to date as well. So always remember to stay passionate and love what you do. Don't only work for money. Otherwise, you cannot survive well, especially your mentally in the field of dentistry. Because dentistry is actually quite stressful subject actually. Because we not only deal with science, we also deal with human. So humans sometimes are difficult and unpredictable. So for example, like a simple procedure for a dental cleaning, if you have a patient who don't want to follow and cannot tolerate what you are providing and don't understand why is it important, then they will become a difficult patients to you, and hence a difficult dentistry. Sometimes you will have like stressful night until you insomnia. So things happen. But anyhow, it's a learning process. So just deal with it. And dentistry is actually a quite fun career and satisfying, I can say so, especially when you complete a small makeover project, and patients really appreciate a lot. And I have patients like actually they will just bring their food and whole family to come just to thank you for helping them. So I think that's about dentistry. But however, the success is not accident, so perseverance is the key. So always stay motivated and keep going. So same goes to you, Emily. Just keep going and do whatever you love and achieve the success you dream of in the future.
Yeah, definitely. Thank you so much for the great advice. And those are all the questions. So thank you for joining me and thank you for your time today.
Thank you so much for inviting me and having me.
Of course,
Stay
thank you.
safe.